this week's Wellness Wednesday, we're taking a look at obesity. Did you know nearly 2 in 5 adults have obesity, and this condition is associated with increased risk of various health problems? And joining us now is Dr. Tanya Pinson, a bariatric surgeon. How are you doing, Dr. Pinson?
Outstanding, Austin. Thank you for having me today.
And thank you for joining us. So now, when it comes to bariatric surgery, of course, you have your pros and your cons. Tell us how it has changed over the years.
Oh, well, over the years, we've changed different procedures and different processes, but with the minimally invasive techniques, bariatric surgery is as safe as taking the gallbladder out. I mean, you basically have about the same kind of consequences from that standpoint. So it's become very safe with minimally invasive techniques. We now do robotic surgery to do our bariatric procedures, and most patients are going home the next day. We keep them in overnight, and they're up walking within an hour of the time they get back, and we require them to walk about a mile a day in the hospital. So they're up and very active very quickly.
Now, when it comes to bariatric surgery, just for our viewers who don't know what it is it?
Bariatric surgery is operations that we do for weight loss. And the most common one is laparoscopic vertical sleeve gastrectomy. So we're using a video camera in the robotic system to take a portion of the stomach out, just leaving a small sleeve of stomach. And with that, patients lose weight and then control their medical conditions.
Oh, okay. And when it comes to candidates for bariatric surgeries, what is it that makes that person a candidate to see you?
Oh, with most of our patients, obesity is a chronic disease, and most of our patients have battled obesity the majority of their lives. So if a patient has a body mass index of 35 to 40, and that's a height to weight ratio with any comorbidity such as diabetes, hypertension, or sleep apnea, they're a candidate. Or if they have a body mass index of 40 or greater, they're a candidate for a bariatric procedure.
Okay, and what about a psychological evaluation? How important is it for you to make sure that the person is ready for something like this?
Well, we're part of a accredited bariatric center, and so at our center we have a very comprehensive program that includes many physicians from different specialties, and so all of our patients undergo a psychological evaluation ahead of time. So we're looking for key things that may prevent them from having optimal weight loss or the best outcomes that they can have. And so that's what we're shooting for. We want everybody to do as well as possible.
Do as well as possible. Okay. And what other advice would you have for someone who is looking to lose weight but may not want to do the bariatric way?
Well, we do have our center, our bariatric center, is a comprehensive weight loss program. So we have a medical division of that as well. So we direct those into the medical weight loss, and those that don't do as well with that, then we would go into the surgical weight loss, which is the bariatric procedures.
All right, so that's great to know that there are so many different choices available.
Oh, absolutely. Well, it's a chronic disease, so you need all the arrows in your I guess you need everything that you can to treat it, okay? You have to have the medical component, you have to have the surgical component, and then maybe a combination to have the optimal outcome for our patients across the board. We know with bariatric procedures, the average patient is going to live about 6 to 8 years longer. If they have diabetes, they're going to live about 8 to 10 years longer. So it's a huge deal if they undergo a bariatric procedure because they have improvement or resolution of their comorbidities. And that's what this is all about. It's all about their health. And we know that if you treat them with an operation and they don't have as much weight loss, now we have medical therapy that you can associate it with to have better long-term weight loss and control their medical conditions.
All right, then thank you so much, Dr. Tanya Pinson, for joining us this afternoon. Well, staying active.